Welcome to The Explainer. Today we're talking about the vital and, let's be honest, often invisible work of community mental health nurses. These are the folks taking mental health care out of the hospital and, quite literally, into our own backyards.
So that brings us to the big question that really frames our whole discussion today. What actually happens when mental health care breaks free from the hospital walls and steps out into our communities? It's a huge shift, so let's really dig into what that means.
And to get a handle on that shift, we have to start with the why. We need to understand the mission that drives this entire field in the first place.
The mission here is, well, it's pretty ambitious. It's about promoting well-being, maintaining it for the long haul, and restoring health when things go wrong. But the real game changer is that last part, right where they live. This isn't just a change in location, it's a completely different philosophy. It moves away from isolating people and toward integrating care into the world they actually inhabit.
All right, so with that mission locked in, let's look at the actual blueprint. How does this work in theory? We're going to unpack the core ideas and goals that guide everything these nurses do on the ground.
So what are we talking about officially? Well, this is a highly specialized field. It's about taking all that deep knowledge from psychiatric nursing and applying it, not in a controlled hospital setting, but out in the messy, dynamic, real world. It's a whole different ballgame. And you can see that this mission isn't just some vague idea. It breaks down into these really clear objectives. And notice, it's not just about treating illness. It's about prevention, it's about rehabilitation, and look at those last 2 points: supporting families and integrating with primary care. That tells you the whole philosophy is holistic. It's about treating the person inside their entire life, their entire support system. And underpinning all of this is a principle that is absolutely 100% non-negotiable. For any of this to work, the care has to be tailored. A one-size-fits-all approach is just destined to fail out here. It has to be individualized for the person, and it has to be sensitive to their culture and their social reality. You have to meet people where they are in every sense of that phrase. Okay, so we've got the mission and the blueprint. But what does a community mental health nurse actually do? Let's open up the toolkit they're using every single day.
You know, this chart says it all. This role is incredibly versatile. A community mental health nurse, or a CMHN, is never just one thing. On any given Monday, they might be an educator for a family, a counselor for a teenager, an advocate fighting for their patients' rights, a case manager juggling appointments, and a direct care provider. They wear all these hats, sometimes all at once. And don't think for a second that this is all just improvised. It follows a very clear, very professional process. It all starts with a thorough assessment, which leads to a diagnosis and a concrete plan. Then comes the implementation, the actual work. But the final step, evaluation, is maybe the most important. Did it work? If not, why? This creates a constant feedback loop, so the care is always adapting and improving.
Another great way to understand this work is to think about prevention, which happens on 3 distinct levels. Primary prevention is about stopping problems before they even start. Think health education in schools. Secondary is all about catching things early to shorten the illness and get people treated fast. And tertiary care is focused on rehabilitation, on limiting the long-term effects of a chronic condition so people can live their fullest possible lives.
Now, of course, this kind of work can't happen in a bubble. It needs a big picture strategy to have any hope of succeeding. And the source material gives us a fantastic case study from India.
In India, you can see this work is anchored by a really solid national framework. You've got major initiatives like the national and district mental health programs, which are designed specifically to push care out from the big cities into local communities. And it's all backed up by the legal power of things like the Mental Health Care Act of 2017.
And what's the point of this whole framework? What's the ultimate goal? Is to deliver on a simple but frankly profound promise. To make sure essential mental health care isn't some kind of luxury item, but something that is genuinely available and truly accessible to every single citizen.
But, you know, policy and theory, that's one thing. The reality on the ground can be very, very different. So in our last section, we have to talk about the huge challenges these frontline nurses are up against every day.
And let's just state this plainly. For all of its promise, for all of its importance, this work is incredibly hard.
The obstacles are massive. I mean, resource limitation sounds abstract, but what it really means is not enough trained nurses, not enough money, and not enough basic infrastructure like clinics or transportation. Then you have deeply ingrained cultural barriers, and looming over everything else, you have stigma. This quote from the source material just hits the nail on the head. Stigma builds invisible walls. And think about that for a second. These aren't just walls of hurt feelings. They are real barriers made of shame, fear, and misunderstanding that physically stop people from getting the help that could literally save their lives.
So when you add it all up, these nurses are fighting a war on multiple fronts. They're battling pervasive stigma, they're working inside underfunded systems, they're trying to navigate complex cultural beliefs, and they are constantly running into thorny legal and ethical questions. It's a tough, tough job.
And that really brings us to our final thought. There's an idea that the health of a community is a reflection of its deepest values. If that's true, then what does our collective approach to mental health, with all its promise and all its challenges, what does that really say about us? That's definitely something to think about.